Gingivitis is a common gum disease that causes inflammation of the gums. Plaque is the primary culprit behind gingivitis. Plaque is a sticky film of bacteria that constantly forms on our teeth. When plaque isn't removed through regular brushing and flossing, it hardens into a substance called tartar. Tartar buildup makes it even more difficult to remove plaque, creating a breeding ground for bacteria. The bacteria in plaque release toxins that irritate the gums. This irritation leads to inflammation, redness, and swelling, which are characteristic signs of gingivitis. Over time, the inflammation can spread to the tissue supporting the teeth, leading to periodontitis. It's important to understand that plaque buildup is a continuous process. Even with regular brushing, plaque can reform within 24 hours. Some common signs to watch out for: red and swollen gums. Healthy gums are typically pink and firm. If your gums appear red, puffy, or feel tender to the touch, it could be an early sign of gingivitis. Bleeding gums. One of the most common symptoms of gingivitis is bleeding gums, especially during brushing or flossing. While occasional bleeding might not be a cause for alarm, persistent bleeding is a definite red flag. Bad breath. The bacteria responsible for gingivitis can also cause persistent bad breath or a bad taste in your mouth. Receding gums. In advanced stages of gingivitis, the gums may start to recede, making the teeth appear longer. Receding gums can expose the tooth root, leading to sensitivity and an increased risk of tooth decay. Section 4. Diagnosis and treatment, taking charge of your gum health. Diagnosing gingivitis typically involves a simple examination by your dentist. The dentist will visually inspect your gums for signs of inflammation, redness, swelling, and bleeding. They may also use a dental probe to gently measure the depth of the pockets between your teeth and gums. Deeper pockets can indicate gum disease. Treatment for gingivitis typically involves a professional cleaning by a dentist or dental hygienist. This cleaning removes plaque and tartar from the teeth and gum line, both above and below the gum line. The dentist may also recommend antimicrobial mouthwashes or topical antibiotics to help control the bacterial infection. In addition to professional cleaning, maintaining good oral hygiene at home is crucial for managing gingivitis. Section 5. Prevention is key. Maintaining optimal oral hygiene. Preventing gingivitis is far easier and less invasive than treating it. Here are some essential tips for maintaining optimal oral hygiene and keeping your gums healthy. Brush thoroughly twice a day. Use a soft bristled toothbrush and fluoride toothpaste to brush your teeth for 2 minutes twice a day. Make sure to reach all surfaces of your teeth and along the gum line. Floss daily. Flossing removes plaque and food particles from between your teeth where your toothbrush can't reach. Use a gentle back and forth motion to clean between each tooth. Regular dental checkups. Visit your dentist every 6 months for a professional cleaning and checkup. Regular dental visits allow your dentist to detect and address any early signs of gum disease. Healthy lifestyle choices. Eating a balanced diet, limiting sugary drinks and snacks, and avoiding smoking can all contribute to good oral health and reduce the risk of gingivitis. Remember, prevention is the best medicine when it comes to gingivitis. By incorporating these healthy habits into your daily routine, you can maintain a healthy smile for years to come.